Hello, everyone. Okay, so I get a confirmation from Janine. Thank you so much for acknowledging. And I hope everyone is still here with me. I know it's already late in your end, but hopefully we'd be able to pretty cover um, much for today, or if not, we will continue this by Wednesday. All right. So going back, as I've mentioned earlier, in your mental health admission, we have actually two types. Okay, it could be voluntary or involuntary. All right. So when we say voluntary admission, okay, so voluntary admission, okay, from the word itself, voluntary, okay, voluntarily, all right, you go to the facility, okay, or the client seeks admission voluntarily, or either the guardian seeks admission voluntarily in the facility. Now, take note that in your voluntary type of admission, the client retains the full civil rights. Okay, so since your exam is your NCSBN, this is a test plan created, or the NCLEX is created by your NCSBN, and NCSBN is based in the United States. So still it applies whether you are in Canada or you are in Australia, that the full civil rights would be retained for your client who is admitted voluntarily. So whatever the civil rights in accordance to which country you are from, either you are in from Canada, all right, or in Australia, those civil rights still retain for those who are admitted voluntarily in a psychiatric facility or in a mental ward. So example of your civil rights, okay, would be the right to vote. Okay, if you are admitted to the facility voluntarily, so your right to vote is never revoked. Okay, still you can exercise to vote. All right, now take note, detaining a voluntary client against his or her will is now termed as your false imprisonment. Okay, false imprisonment. If you detain, okay, a person who is voluntarily admitted, okay, because they seek help voluntarily, that means that by the time that they wish to like go out, or when they feel better that they're able to cope with their problems, so if they request that I can go home now, hopefully by tomorrow or 2 days after, then they can go home. Okay, but letting them stay in the facility, okay, is now termed as your false imprisonment. Now, a client has a right to receive release upon request. Okay, a client has a right to receive release upon request. But take note, nurses, yes, voluntarily client, they can be released, all right, only if the protocol in this facility is, it would be like 2 days after the client has admitted, or 3 days after the client has been admitted. If the observation or if the evaluation of the doctor is good, then you can be released. All right, but if not, okay, when you stay at the facility and then the observation of the doctors would let's say recommend you to have like another test, this is for your own good, this and that. So that's the time, all right, that the voluntary status would be now changed to your involuntary status, most especially, all right, most especially if you are manipulative, or if you would have, or if you would cause a harm to yourself or to others. All right, so that is a time that detaining, okay, or false imprisonment would no longer be applicable. Okay, if and only if, okay, the client is manipulative or has or that can cause a harm to himself or to others. Because again, our priority in your psychosocial integrity question or in your psychiatric integrity question is what? Safety. Okay, are we clear? Are we clear? Okay, are we clear, nurses?
Yes, ma'am.
Okay, so again, if the assessment of the doctor is not good, or if you have been like a manipulative, or you can cause harm to others or to yourselves, then that's the time from voluntary status, it will now change to your involuntary status. Okay, so involuntary, this is necessary for all mental ill clients, okay, who are a danger to themselves, okay, or to others, or need psychiatric treatment or physical care. So even though that they are involuntarily admitted, involuntary against my will to be admitted in the facility, still I retain my right to be or to have an informed consent. All right, even though that, you know, when you are mentally ill, you cannot understand what the doctor is saying to you, but still it is your right to receive your informed consent. What else? They also have the right to refuse treatment unless a separate or specific treatment order is obtained from the court. All right. Now, if possess a threat to self and others, patient loses the right to refuse. Only if, okay, the patient has a threat to himself or to others, and that's a time that my right to refuse is, okay, revoked. All right, so that is your voluntary and involuntary type of your mental health admission. Are we clear? Clear, nurses? Clear? Yes. Okay, thank you so much for acknowledging. Okay, so first, all right, in our we're going to talk about now, we'll now dive into our, okay, anxiety or mental health disorder. Okay, so first, let's talk about your anxiety and anxiety related disorder or anxiety disorder. Okay, so when we say anxiety, okay, so this is like a feeling of apprehension or impending doom, right? So just like you are right now, nurses, when you think about your upcoming exam, we feel anxious, right? Is it does not, like, every one of you does not feel anxious at all? Everyone does feel anxious. Okay, so I don't think that not or in this class nothing or no one would feel anxious thinking about their exam. Okay, Rini, okay, can you relate to that you are having anxiety right now as you are already thinking, especially if your exam is already fast approaching? Are you feeling anxious? Okay, when we say anxious or anxiety, okay, when we say anxiety, this is actually more of a subjective, okay, subjective feelings, okay, because these are your emotions or your feelings, all right, that, okay, includes apprehension, uneasiness, or uncertainty, or even dread. Okay, so this is more of a subjective feelings. Okay, so I'm feeling so, let's say I'm feeling nervous. Okay, so this is something that we'd be able to verbalize to our nurses. Okay, and also not only subjective, nurses as well can definitely observe the client who are already having anxious feelings, okay, or is already having anxiety. Most especially, if you have episodes of your severe anxiety attacks or your anxiety attacks. Okay, so anxiety would also occur, all right, this would occur as a result of, let's say, a threat that may be misinterpreted. Okay, so there is a cause to this. Okay, so our feeling of apprehension, our feeling of uneasiness, okay, there's always a factor to it. But basically, what is the reason as to why, okay, an individual would have anxiety? Most especially, okay, if the anxiety is not managed it progresses to your severe type of anxiety, or worse, into your panic level of anxiety. Okay, so what could be the effect? Okay, or what could not the effect, but what could be the cause? Okay, so we actually have a scientific cause to that. Okay, and this is actually due to a low GABA. Okay, so one of the cause is your low GABA. So what is your GABA? Any idea? What is your GABA? Any idea what is your GABA?
It's a neurotransmitter. That's a neurotransmitter that
Okay.
calms the body.
All right. Well, thank you so much.
It calms the body, like unlike the dopamines and the serotonins, which is the high. Hello?
Yes, hello. Sorry. It seems that you're on.
I said GABA is a neurotransmitter. It's the low, it lowers the mood. It's like a low.
Yes. Okay. So it is your GABA. Yes, this is your a neurotransmitter. We're in when we are in a feeling of stressful situation or a provoking situation. It is your GABA that would calm us down. All right, this is something that would makes us feel relaxed. However, in clients with anxiety, panic anxiety level, or severe anxiety level of anxiety, they have a low GABA, or your gamma butyric. Okay, gamma amino butyric acid. So your gamma aminobutyric acid, this is actually a neurotransmitter that would help us calm down. Whenever we are feeling stress, this is something that would set in to calm us down. But remember, in your clients with anxiety, they are feeling uneasy. Okay, they cannot sit still. They keep on pacing. They keep on walking. They're very nervous. Okay, it's because for a reason that these clients, okay, have a low GABA. All right. So again, that is one of the costs as to why the client would have anxiety or anxiety related disorder. Another would be if the client has a what? Low defense mechanism. Okay, remember your defense mechanism. This is something that would help us, be in an unconscious, or let's say defense, low defense mechanism. Again, defense mechanism is a normal response that would somehow manage anxiety, that would make us calm down. But if you have a low defense mechanism, low coping mechanism, then anxiety can occur. All right, so we actually have levels of anxiety. Okay, so any idea how many levels of anxiety do we have? Any idea how many levels of anxiety do we have? 4. Very good, Amanda. Okay, so we have 4 levels of anxiety. So we have your mild, moderate, we have severe, and we have your panic. So among of these levels, what is ideal? Okay, what is ideal would be the mild level of anxiety. In fact, mild level of anxiety, this is a healthy type of anxiety. Healthy in a sense that, okay, most especially for you nurses, yes. Okay, so Luciana, are you having problem?
Yeah, I think there's an issue with the sound.
My sound?
Yes.
My audio? How about this one?
Oh yeah, good.
Okay, better?
Yes.
Okay, perfect. Well, sorry about that. Okay, so again, among of these level of anxiety, what is healthy, what is ideal would be the what? The mild level of anxiety. Okay, this is the most favored. So as much as possible, you guys are feeling anxious right now, but let's keep it in the mild level of anxiety. Why? It's because mild level of anxiety, this actually increases our alertness. Okay, this make us alert. Okay, this increases our perceptual field. It motivates or enhances creativity and increases your learning. Basically, you're aware that you have an upcoming exam. So to manage, okay, or in order to pass the NCLEX exam, so mild level of anxiety, you would tend to study, right? So it makes you alert. It increases your perceptual field. The more alert you are, or the more you are, eager to study and learn. Okay, that is your mild level of anxiety. Your moderate level of anxiety, okay, the client would have narrow perceptual field. But even though that you have a narrow perceptual field, the good thing about it is that, okay, you still have that learning and problem solving ability. Your severe level of panic, or level of anxiety rather, okay, you have no learning and no focus. Okay, so problem solving is not possible. So if you would try to solve a problem on your own, okay, because you are, okay, in a severe, okay, state of your anxiety. We also have your panic. All right, panic, worst of all, okay, or most dangerous of all, is your panic level of anxiety. Why? Because this can lead to death if not managed. All right, so this is already a client is associated with dread and terror, a sense of impending doom, disorganized personality, irrational thoughts, distorted perception, inability to concentrate, and again, if not managed, these can lead to exhaustion and even death. All right, so who among of these, or at what level that management really should focus on? Okay, that would be your panic. But okay, progressing the level of anxiety may not happen if, okay, if in the mild level of anxiety or moderate level of anxiety, you are already verbalizing your your feelings. You express your concerns, your emotions. Okay, you allow verbalization. All right, so that, okay, it cannot progress to severe or even panic. All right, so how do we manage, okay, so that these would not progress, okay, from mild to moderate level of anxiety, so that it will not progress to severe or panic? So as a nurse, you have to help the client identify anxiety. What's causing your anxiety? Okay, remember, this occurs, okay, with a threat or a situation. Help that client identify that problem. Okay, I'm experiencing anxiety or I'm feeling anxious. It's because I have an upcoming exam, this and that. All right. Now, you may want to encourage the client to verbalize, okay, the feelings and concern, because again, expression of feelings would somehow relieve tension. All right. And encourage gross motor exercise. All right. Encourage the client to do gross motor exercise. So these simple management, in dealing with a client or in a level of mild or moderate of anxiety, this can help not progress into your severe and panic. But however, if it now progresses to severe and panic, all right, management nurses includes, okay, the 4S and the A. Okay, so the 4S and the A, or the 4S would be the nursing intervention, and the A would be the medical management. All right, so the 4S simply provide safety for the client. Okay, again, safety is our priority. Okay, most especially if the client has panic level of anxiety. Okay, not just panic, but also severe. Remember, they have no focus, okay, and they cannot solve problems on their own. So safety is priority. All right, what else? Stay with the client. All right, stay with the client. Speak in a low tone of voice. All right, speak in a low tone of voice. What else? Give simple instruction. All right, give simple instruction and give your anxiolytics. Okay, your anxiolytics, this would somehow increases the GABA, or this would manage your or this would cause the client to feel relaxed. Okay, so we have two types of your anxiolytics. We have your benzodiazepine and your non-benzodiazepine. So your benzodiazepine, these anxiolytic drugs that ends with zepam, okay, zolam, aprazolam, diazepam. All right, so these are your anxiolytics. Hopefully I'd be able to interject or incorporate those your psych drugs. All right, so those are your anxiolytics, okay, that is commonly prescribed for your clients, most especially with panic and severe level of anxiety. Okay, now take note, in your panic anxiety, there's already a disorganized personality. What else? Distorted perception, and also to include, all right, this can also have an affectation with their vital signs. All right, so vital signs would include increasing heart rate. Okay, what else? Increasing respiratory rate. Okay, they have tachycardia, tachypnea. All right, so then definitely, okay, we need attention, or safety is our priority to these clients. All right, are we clear? In general management though, okay, general management for these clients, okay, with anxiety, okay, so as a nurse, you have to identify and decrease the stimuli or the cause of what's causing the client to have anxiety. Again, provide safety, provide a quiet and calm environment. All right, quiet and calm environment. What else? Promote relaxation technique. Okay, breathing exercises, guided imagery. Okay, monitor the vital signs, because again, vital sign changes would help you identify that, okay, especially if the client is already having panic, okay, level of anxiety, and administer your anxiolytics as prescribed. Either it can be your benzodiazepine or your non-benzodiazepine. Okay, are we clear? Okay, are we clear, nurses? Yes, thank you so much for acknowledging, Janine. Okay, so let's try to answer this practice question. Let's try to answer this. Okay, the client who is recently admitted diagnosed with panic attack disorder is sitting in the waiting room, appears anxious, trembling, starts to hyperventilate, and is sweating. Which intervention should the nurse implement first? Okay, is it number one, encourage the client to take a slow, deep breath? Number two, assess the client's vital signs. Sorry. Number three, remove the client from the waiting room. Number four, administer alprazolam, Xanax, a benzodiazepine. Okay. All right. Again, which intervention should the nurse implement first? Okay, implement first, or your priority action. This is actually an example of your prioritization type of a question. All of these options are correct, but you have to prioritize, okay, which one is your best answer. How about the others? Okay, majority answered, remove the client from the waiting room. Let's go back to the question. The client who is recently admitted, okay, diagnosed with panic attack disorder. All right, panic attack disorder. And the client is sitting where? In the waiting room, appears to be anxious, trembling, and starts to hyperventilate. All right, and the client is sweating. So you were asked, which intervention should the nurse implement first? Okay, so which intervention would be what? You have to encourage the client to take a slow, deep breathing or breath. Okay, encourage the client to take a slow, deep breath. Why? Because go back to the question. Okay, what is the problem here? The client is already hyperventilating. Okay. Okay, so to calm the client down, okay, to calm the client, encourage him to take a slow, deep breathing. Okay, take a slow, deep breath. All right, so take a slow, deep breath, and then that's the time that you would remove the client from the waiting room. All right, so if we are going to make this as an ordered response, okay, so as an ordered response, first, again, number one would be encourage the client to take a slow, deep breath. Now, after we have encouraged slow, deep breathing, then that's the time that we remove the client. Okay, remove the client from the waiting room. All right, and then number three would be administer your alprazolam or your Xanax. And four would be your assess the client's vital signs. Okay, because it would somehow just take 20 to 30 minutes for these drugs to take its effectivity. So to manage the effectivity of the drugs, okay, to see if there is already changes in the client's vital signs. Okay, so we have to assess the client's vital signs in this, okay, in this exam, okay, the last one. All right, are we clear? Are you following? Clear, nurses?
Yes, ma'am.
Yes. Okay. Thank you so much, Amanda. So Navjot is asking, show the slide of nursing intervention. Okay. So show the slide of nursing intervention. Okay. Okay. Are we clear? Okay. Clear, nurses?
Yes, ma'am. Thank you.
Okay, very good. Okay, so again, that is your answer. Number one is the correct answer. Okay, so next we have, okay, post-traumatic stress disorder. Okay, your PTSD. PTSD is actually an anxiety-related type of disorder or anxiety disorder. Why? Okay, PTSD would usually occur after experiencing a psychological traumatic event that the person is prone to re-experience the event and have recurrent or intrusive dreams or flashbacks. Okay, so let's say after being robbed, okay, you are, or there is a hostage taking. So that scenario, okay, or traumatic event would have a recurrent, you know, you would always have that emotion or feeling, anxious feeling. Okay, these are again psychological event that happened in the past, wherein you would re-experience the event, okay, and have recurrent or intrusive dreams or a flashback. All right, so this is usually common caused by natural disaster, terrorist attacks, okay, accidents, okay, rape, crime or violence, or it can be a form of your sexual abuse, emotional abuse, or your physical abuse. Okay, what happens when you have PTSD? Okay, you are prone to re-experience the traumatic event. Okay, so imagine yourself being in a terrorist attack. Okay, so definitely that is somewhat that like it would, you know, cause you to be in a panic state, right? Or in a panic mode or severe anxiety. And all of a sudden, even though that you have already you know, already out from that terrorist attack, all of a sudden, whenever you see something that is similar to that, you know, traumatic event, then you would have to have anxiety. You would experience anxiety. Okay, so clients with PTSD, they would have emotional numbness. Okay, they are detached to the current you know, current situation, or detached with the current or the updated event in their lives. Okay, they would also tend to be depressed. All right, they have anxiety feelings most of the time, especially there is reawakening, or if they would re-experience that traumatic event. Okay, they would have nightmares and flashbacks, and they would tend to be hyper vigilant. Okay, they would have to be hyper vigilant. They become hyper vigilance. So our intervention here, nurses, is to, okay, be non-judgmental. Okay, being non-judgmental, have or show that acceptance that what they're feeling, okay, is a trauma that they experienced in the past. Okay, it's normal for you to experience that. Okay, because again, it's so hard for you to cope up with that situation or that scenario which caused you to have that experience. And be non-judgmental. All right, encourage expression of feelings for these clients, assist the client to develop adaptive coping mechanism and use relaxation techniques. All right, therapy again would include your systematic desensitization, okay, or your desensitization, okay, gradual exposure of like gradual exposure, let's say, of an event or an object that the client would have anxiety. All right, and of course support groups. All right, that is your PTSD, post-traumatic stress disorder. Okay, again, PTSD causes anxiety of these clients, hence this is one of the example or one of the types of your anxiety related disorder. All right, next we have your obsessive compulsive and related disorder, or your OCD. All right, your OCD. So when we see obsession, these are your recurrent thoughts, okay, recurrent persistent thought and urges or image that are experienced as intrusive or wanted. Okay, you have this thinking. Now, compulsion happens, okay, wherein there's already repetitive behaviors or mental act that an individual feels driven to perform in response to your recurrent thought or your obsession. And through compulsion, this would somehow decreases the anxiety of the client. However, in your obsessive compulsive disorder, okay, if you do not address the obsession, then compulsion would never stop. Okay, now, and if this client would not do compulsion, okay, the more it increases their anxiety. Okay, so very common example of your obsessive compulsive disorder would be your hand washing. Now, if you do not address, okay, that you think that, you always have this in mind that my hands are still dirty, so that's why I have to clean my hands, I have to wash my hands, and then compulsion happens. The problem with this is that, okay, in your obsessive compulsive disorder, this can actually disrupt the normal activities of the client. Instead that you'll be eating on time, you can no longer eat on time. Why? Because you are doing compulsion, because you think that your hands are still dirty. Instead of going to do your work, okay, as early or on time, you are always late to go to work, because you always think that, all right, your doors are not yet locked. All right, so you have to think, oh, you have to go back. Okay, so, oh, is my door locked? Then you locked it already. Then, when you're on your way a few miles, going back to your work, then you would go back home because you think that again, oh, I have not locked my room. Okay, that is your obsessive compulsive disorder. All right, are we clear? Other related disorder, though, we have your hoarding disorders. Okay, so hoarding, you are collecting things which are no longer necessary, but if you do not collect this, it would cause you to have anxiety. Okay, obsession would be thinking about these things and this stuff. Compulsion would be like, collecting all those stuffs. We also have your skin picking disorder or your excoriation. Okay, or we also have your trichotillomania or your hair pulling disorder. All right, And usually for your clients with obsessive compulsive disorder, okay, defense mechanism is your undoing, all right, repression and displacement, all right? But I want you to focus on the management for these clients, okay, with obsessive compulsive disorder. Now, as a nurse, you have to ensure that the basic needs are met. Because again, the problem here is that it disrupts normal, okay, activities. So instead of eating on time, they can no longer eat on time because again, the common problem of your compulsion would be hand washing. So ensure that the basic needs are met. So identify the situation that aggravates compulsive behavior. All right. Do not interrupt the rituals, okay, unless, okay, it is at risk to danger, okay, to the client and as well as to the others. All right. Allow time to complete the compulsive behavior, but set limit on the behavior of the client. Okay, set limit on their behavior because again, their compulsion is not healthy. It's not acceptable. Okay, allow them to complete hand washing, but okay, let's say for example, once they are already admitted, so if they used to do compulsion in their home for like 1 hour, okay, narrow it down or trim it down to at least 30 minutes. 30 minutes after, okay, and let them stop the compulsion. Or do it gradually. So if they used to do hand washing for 1 hour at home, once they're admitted, do it like 10 minutes or 30 minutes, okay, which is more acceptable to the client. All right. Now, implement a schedule. Okay, implement a schedule, structure simple activities, okay, and as well as games. Okay, these activities such as games would somehow divert their attention to their obsession, their thinking. All right, and structure simple activities. These activities are with time. So at 9 a.m., okay, 9 a.m. to 9:05, I will just do my hand washing. 9:05 to 9:30, I will now eat my breakfast, okay, or that is your structure simple activities. Okay, this is something that they would be able to follow on their own. All right, now establish a written contract. Okay, a written contract, by the way, this is something like more of an agreement between the nurse and the client. All right, it's not really a legal document that would be included in the nurse's chart. However, these written contract are just agreement. So let's say Marjorie Dalig agreed that I'll be washing my hands for blah blah blah, so on and so forth. Okay, signed, and okay, the nurse will also sign because that serves as your agreement. All right. Now, as a nurse, you also have to recognize and reinforce positive non-ritualistic behavior. All right, reinforce positive and non-ritualistic behavior. Okay, so let's just finish this one. Okay, last anxiety-related disorder, we have your phobia. So when we say phobia, this is your irrational fear. Okay, irrational fear of an object or a situation that is causing you to have anxiety. All right. So common example would be what? Your, okay, acrophobia, fear of heights. I'm scared of heights, so you cannot let me walk into this, glass, something which is very, very common in China. What else? Agoraphobia, fear of open spaces. Okay, whenever you are in public, you are scared to be in public. So which is kind of like irrational, right? So claustrophobia, fear of closed spaces. What else? Xenophobia, fear of strangers. So we all have phobias, I believe so. We all have, something that we are scared of, but at least this is somehow managed. But if not, if you're so exposed to it, so then definitely this would cause problem as well. All right. So management for your clients with phobia. All right. So identify again the basis of anxiety, okay, or the fear. Because again, these fears are causing, or your phobias are the ones that causing you to have anxiety. And allow expression of feelings, okay, relaxation techniques, breathing and exercise, all right, and desensitization, gradual introducing the feared object. Have you seen a series which is X Factor? Have you seen that one, X Factor?
Yes.
Yes, right. In your X Factor, that was a series long time ago. I think 90s children would be able to relate to that. Okay, X Factor. So that one, like in that X Factor, those candidates are exposed to their feared objects. So yeah, and if you wish to watch that one, so you can definitely see that one in YouTube, I believe so. That's still, we still have that one nowadays in YouTube. All right. So we will continue the lecture tomorrow, or not tomorrow, but on Wednesday. Okay. So we will continue with the mood disorders. All right. So any questions, nurses? Any questions? None so far?
No, ma'am.
Okay, well, I hope you learned something today.
Yes, ma'am.
Okay, well,
Yes,
nice
ma'am.
to hear that. All right, so definitely we'll learn more as we go along with our day 2 and day 3 of our mental health nursing. Okay, so thank you so much. And I hope